Hello viewers, this is Dr. Hiya Agarwal, fertility consultant at Neelkanth IVF Jodhpur. Today we will be talking about polyps and its impact on fertility. Polyp or the endometrial polyp are the growth which is seen in the inner lining of the uterus, that is endometrium. Women who have fertility issues may also complain of increased bleeding during the periods or may have spotting or some kind of bleeding in between the menstrual cycles. These are the women who usually have the problems of endometrial polyp. They may be of a smaller size, but they can impact the fertility as they may impair the implantation of the embryo and thus resulting into potential infertility. Polyps can be formed in the endometrial cavity, which can be either just attached to cavity and which is going into the cavity, or it may come out of the cervix and into the vaginal and may cause intermenstrual or postcoital bleeding. Polyps are usually diagnosed on the transvaginal scan or the internal sonography when women come to the clinic with the complaints of either intermenstrual spotting or a fertility issue or excess bleeding during the periods with painful menses. When we do the scan, we see an increased echogenic mass in the endometrium cavity, and when we do a color Doppler on it, there might be a vessel supplying to it which is diagnostic of the polyp. We can also instill some fluid in the endometrial cavity to confirm the diagnosis of the polyp on the ultrasonography. What are the causes of formation of polyp in the endometrial cavity? There can be a hormonal imbalance. Usually the hormones, which are female hormones, estrogen and progesterone, are in sync and they produce the endometrium on average every month, and it sheds according to the hormones present in the body. But when there is imbalance between the estrogen and the progesterone and there is increased estrogen level in the female body, it can result into polyp formation. Another cause can be a chronic infection of the endometrium. This chronic infection leads to the inflammation and the swelling of the endometrial tissue, resulting to a polyp formation. One of the most grave cause of polyp formation can be a cancerous formation or a tumorous growth in the endometrium, which is of very urgent cause, and it has to be treated immediately. We have to diagnose it, take a biopsy out of it, and if it turned out to be tumorous, then it has to be removed along with the removal of the uterus depending upon the carcinoma it has been diagnosed with. Women who are seeking fertility and is having a polyp in the endometrial cavity should definitely undergo polypectomy through the hysteroscopy, because it may impair implantation when they are going through a fertility treatment. If the women are not seeking fertility and they have completed their family and the polyp size is less, it can be treated medically with the progesterone medications. Polyps less than 1.5 centimeter can dissolve with the progesterone medications. If the polyp is increasing its size, is not responding to medications, or the patient is persistently having symptoms, then they should go for a definitive treatment with the help of hysteroscopic polypectomy. It is a very minimal invasive procedure. It is a day care procedure, can even be done without anesthesia, and it requires 10 to 15 minutes of the operating time, and the patient can be discharged on the same day in the evening. So if the women who are having this issue or who have this menstrual bleeding or intermenstrual bleeding along with the fertility issue, they should definitely consult a fertility physician for the better opinion as soon as possible, because treating polyps with the minimal invasive surgeries is very much possible today, and they can achieve the dream of parenthood as soon as possible with the very advanced techniques now available. If you have any other query regarding the polyps and the fertility treatments, you can call the given contact number below. Thank you.